1. A nurse is caring for a client with left-sided heart failure who reports new-onset shortness of breath or orthopnea and a productive cough with pink, frothy sputum. Which nursing action is the priority? 1. Administer a PRN antitussive. 2. Elevate the head of the bed. 3. Notify the healthcare provider. Answer: elevate the head of the bed. Rationale: elevating the head of the bed improves oxygenation and reduces the work of breathing, which is a priority in acute pulmonary edema associated with left-sided heart failure. 2. The nurse receives 4 reports during shift change. Which patient should the nurse assess first? 1. A client with heart failure who gained 2 pounds overnight. 2. A client reporting fatigue with ambulation. 3. A client with heart failure with bibasilar crackles and oxygen saturation of 88%. Answer: a client with heart failure with bibasilar crackles and oxygen saturation of 88%. Rationale: the client with low oxygen saturation and crackles may be experiencing worsening pulmonary congestion or respiratory compromise and requires immediate assessment. 3. A nurse is delegating tasks for a client with stable chronic heart failure. Which task is appropriate to assign to the UAP? 1. Teaching fluid restriction. 2. Monitoring for orthopnea. 3. Measuring daily weight. Answer: measuring daily weight. Rationale: measuring daily weight is within the scope of practice for a UAP and is important for monitoring fluid retention in heart failure. 4. The nurse is preparing to administer furosemide to a client with heart failure. Which assessment must be done before administration? 1. Apical pulse. 2. Blood pressure and potassium level. 3. Respiratory rate. Answer: blood pressure and potassium level. Rationale: furosemide is a loop diuretic that can cause hypotension and hypokalemia. Monitoring these parameters ensures safe medication administration. 5. A client with heart failure is prescribed a low-sodium diet. Which meal selection by the client requires further teaching? 1. Grilled chicken with steamed vegetables. 2. Turkey sandwich with pickle. 3. Oatmeal with banana. Answer: turkey sandwich with pickle. Rationale: pickles are high in sodium and should be avoided in a low-sodium diet to prevent fluid retention and worsening of heart failure. 6. A nurse is monitoring a client with heart failure receiving for furosemide. The client reports leg cramps and weakness. What is the most appropriate nursing action? 1. Notify the provider. 2. Encourage mobility. 3. Discontinue for fluids. Answer: notify the provider. Rationale: leg cramps and weakness may indicate hypokalemia from diuretic therapy and should be promptly reported for possible electrolyte replacement. 7. A client newly diagnosed with heart failure is prescribed digoxin. Which client statement indicates the need for further education? 1. I will check my pulse before taking my medication. 2. I can take an antacid with digoxin to prevent stomach upset. 3. I will report any visual disturbances to my provider. Answer: I can take an antacid with digoxin to prevent stomach upset. Rationale: antacids can interfere with the absorption of digoxin and should not be taken together. This statement reflects a need for further education. 8. During morning rounds, which finding in a client with heart failure should be reported to the provider first? 1. Weight gain of 3 pounds in 2 days. 2. Blood pressure of 90/60 millimeter of mercury. 3. Cough producing pink frothy sputum. Answer: cough producing pink frothy sputum. Rationale: pink frothy sputum suggests pulmonary edema, which is a life-threatening complication of heart failure and requires immediate intervention. 9. A client with heart failure is receiving an ACE inhibitor. Which laboratory result requires priority action? 1. Potassium level of 5.9 milliequivalents/L. 2. Hemoglobin level of 12 G/DL. 3. Sodium level of 138 milliequivalents/L. Answer: potassium level of 5.9 milliequivalents/L. Rationale: ACE inhibitors can increase potassium levels. Hyperkalemia is potentially dangerous and requires prompt intervention. 10. The nurse is evaluating discharge instructions for a client with heart failure. Which client action indicates proper understanding? 1. Weighing every other day. 2. Limiting fluid to 1.5 liters per day. 3. Skipping diuretics if no swelling is noted. Answer. Limiting fluid to 1.5 liters per day. Rationale. Fluid restriction is important in managing heart failure to reduce fluid overload and prevent decompensation. 11. A nurse is reviewing medication orders for a client with heart failure. Which combination requires clarification? 1. Digoxin and spironolactone. 2. Lisinopril and potassium chloride. 3. Furosemide and potassium supplements. Answer. Lisinopril and potassium chloride. Rationale. Lisinopril can increase potassium levels. Giving potassium chloride with it may cause hyperkalemia and should be clarified. 12. A client with heart failure becomes confused and restless. Which action should the nurse take first? 1. Reorient the client. 2. Check oxygen saturation. 3. Notify the provider. Answer. Check oxygen saturation. Rationale. Confusion and restlessness may be early signs of hypoxia. Oxygenation must be assessed first to determine appropriate intervention. 13. A nurse notes a BNP level of 980 pg/ml in a client with dyspnea. How should the nurse interpret this finding? 1. Suggests fluid overload from heart failure. 2. Indicates resolution of heart failure. 3. Reflects normal cardiac function. Answer. Suggests fluid overload from heart failure. Rationale. Elevated BNP levels are associated with ventricular stretch and fluid overload, supporting the diagnosis or worsening of heart failure. 14. The nurse is caring for a client with right-sided heart failure. Which clinical finding is most expected? 1. Pulmonary crackles. 2. Peripheral edema. 3. Orthopnea. Answer. Peripheral edema. Rationale. Right-sided heart failure leads to systemic venous congestion, often resulting in dependent edema. 15. A client with heart failure is found to have jugular vein distension and hepatomegaly. What does the nurse interpret this to indicate? 1. Pulmonary edema. 2. Right-sided heart failure. 3. Medication toxicity. Answer. Right-sided heart failure. Rationale. Jugular vein distension and hepatomegaly are hallmark signs of right-sided heart failure due to systemic fluid buildup. 16. A nurse is developing a care plan for a client with heart failure. What is the most appropriate goal? 1. The client will experience increased urine output. 2. The client will have clear lung sounds. 3. The client will tolerate a regular diet. Answer. The client will have clear lung sounds. Rationale. Clear lung sounds indicate resolution of pulmonary congestion, a key goal in heart failure management. 17. A client with heart failure is receiving oxygen therapy. Which task can be delegated to the UAP? 1. Adjusting the oxygen flow rate. 2. Monitoring oxygen saturation. 3. Assisting the client with ambulation. Answer. Assisting the client with ambulation. Rationale. UAPs can assist with ambulation, but oxygen therapy adjustments and monitoring are nursing responsibilities. 18. The nurse reviews lab results of a client with heart failure taking digoxin and notes a digoxin level of 2.5 nanograms per milliliter. What is the most appropriate action? 1. Administer the next dose. 2. Withhold the drug and notify the provider. 3. Give an antiemetic with the dose. Answer. Withhold the drug and notify the provider. Rationale. A digoxin level greater than 2.0 nanograms per milliliter indicates toxicity. Withholding the medication and informing the provider is the safest action. 19. A client with decompensated heart failure has cool, clammy skin and hypotension. What complication should the nurse suspect? 1. Hypovolemia. 2. Cardiogenic shock. 3. Sepsis. Answer: cardiogenic shock. Rationale: decreased cardiac output, leading to poor perfusion and hypotension, is characteristic of cardiogenic shock, a complication of severe heart failure. 20. A nurse is caring for a client with heart failure who has dyspnea on exertion. Which nursing intervention promotes energy conservation? 1. Encourage the client to take short, frequent walks. 2. Encourage fluid intake. 3. Provide frequent rest periods during activity. Answer: provide frequent rest periods during activity. Rationale: rest periods reduce oxygen demand and fatigue, helping clients with heart failure conserve energy and improve tolerance to activity. 21. A nurse is assessing a client with chronic heart failure who reports waking up at night feeling short of breath. Which term best describes the symptom? 1. Orthopnea. 2. Paroxysmal nocturnal dyspnea. 3. Sleep apnea. Answer: paroxysmal nocturnal dyspnea. Rationale: paroxysmal nocturnal dyspnea is a sudden awakening at night with shortness of breath due to fluid redistribution when lying flat, common in heart failure. 22. A client with heart failure is scheduled for discharge. Which instruction is most important for preventing readmission? 1. Take antacids with meals. 2. Monitor daily weight and report gains over 2 pounds in 24 hours. 3. Avoid caffeine after 6 p.m. Answer: monitor daily weight and report gains over 2 pounds in 24 hours. Rationale: sudden weight gain often indicates fluid retention and worsening heart failure. Early reporting can prevent hospital readmission. 23. A nurse is evaluating the effectiveness of diuretic therapy in a client with heart failure. Which finding indicates improvement? 1. Reduced peripheral edema. 2. Increased jugular vein distension. 3. Decreased urine output. Answer: reduced peripheral edema. Rationale: diuretic therapy aims to reduce fluid overload, which is reflected in the resolution of edema. 24. Which assessment finding in a client with heart failure indicates the need for immediate intervention? 1. Heart rate of 92 BPM. 2. New onset of confusion. 3. Mild bilateral pedal edema. Answer: new onset of confusion. Rationale: confusion may indicate cerebral hypoperfusion, hypoxia, or worsening heart failure and requires prompt action. 25. A nurse is caring for a client newly diagnosed with heart failure. Which nursing diagnosis takes priority? 1. Activity intolerance. 2. Fluid volume excess. 3. Impaired skin integrity. Answer: fluid volume excess. Rationale: fluid volume excess can impair oxygenation and organ function, making it the priority in the management of heart failure. 26. A nurse is preparing to administer carvedilol to a client with heart failure. Which vital sign must be assessed prior to administration? 1. Temperature. 2. Respiratory rate. 3. Heart rate. Answer: heart rate. Rationale: carvedilol is a beta blocker that can lower the heart rate. Bradycardia is a potential side effect and must be monitored. 27. A nurse is teaching a client with heart failure about sodium intake. Which statement indicates understanding? 1. I can eat canned soup if I rinse it. 2. I will avoid processed meats like bacon. 3. Adding salt after cooking is acceptable. Answer: I will avoid processed meats like bacon. Rationale: processed meats are high in sodium and should be avoided to reduce fluid retention and manage heart failure symptoms. 28. Which task related to the care of a heart failure patient can the nurse safely delegate to the LPN? 1. Teaching the patient about medication side effects. 2. Evaluating effectiveness of diuretic therapy. 3. Administering prescribed oral diuretics. Answer: administering prescribed oral diuretics. Rationale: administering medications is within the LPN scope, but teaching and evaluating outcomes are RN responsibilities. 29. A nurse notes that a client with heart failure has a serum sodium of 128 milliequivalent/L. What is the likely cause? 1. Inadequate sodium intake. 2. Excessive water retention. 3. Poor dietary compliance. Answer: excessive water retention. Rationale: in heart failure, dilutional hyponatremia often occurs due to excess fluid retention and not sodium loss. 30. Which is the most appropriate nursing action when a client with heart failure becomes dyspneic while ambulating? 1. Encourage the client to continue. 2. Have the client sit and rest. 3. Notify the provider immediately. Answer: have the client sit and rest. Rationale: activity-induced dyspnea indicates decreased tolerance. Rest helps decrease oxygen demand and prevent further decompensation. 31. A client with heart failure reports skipping diuretic doses to avoid urinating at night. What should the nurse do first? 1. Reinforce the need for medication adherence. 2. Contact the provider. 3. Suggest taking the diuretic before bedtime. Answer: reinforce the need for medication adherence. Rationale: non-adherence to diuretics can lead to fluid overload and decompensation. Education is the first step to improve compliance. 32. A nurse assesses a client with heart failure and notes cool extremities, weak pulses, and delayed capillary refill. What complication should the nurse suspect? 1. Hypervolemia. 2. Dehydration. 3. Decreased cardiac output. Answer: decreased cardiac output. Rationale: these are signs of poor perfusion associated with reduced cardiac output in advanced heart failure. 33. A nurse is caring for a client with heart failure receiving oxygen by a nasal cannula. Which finding indicates improvement? 1. Respiratory rate of 24 and anxious appearance. 2. Oxygen saturation of 96% and reduced dyspnea. 3. Need to increase oxygen to 4 liters per minute. Answer: oxygen saturation of 96% and reduced dyspnea. Rationale: improved oxygenation and decreased shortness of breath indicate the therapy is effective. 34. Which dietary selection by a client with heart failure demonstrates the need for additional teaching? 1. Grilled salmon with brown rice. 2. Canned vegetable soup and crackers. 3. Fresh fruit and whole wheat toast. Answer: canned vegetable soup and crackers. Rationale: canned soups and processed crackers are often high in sodium and inappropriate for heart failure diets. 35. A client hospitalized for heart failure has 1,000 milliliters intake and 600 milliliters output in 8 hours. Which action is appropriate? 1. Reassess in 4 hours. 2. Contact the provider immediately. 3. Increase fluid intake. Answer: reassess in 4 hours. Rationale: a temporary positive fluid balance is expected in early treatment. Ongoing monitoring is appropriate unless clinical signs worsen. 36. A nurse is providing discharge teaching for a client with heart failure. Which instruction is most important to prevent fluid overload? 1. Take a daily multivitamin. 2. Avoid OTC cold medications. 3. Weigh daily at the same time. Answer: weigh daily at the same time. Rationale: daily weight tracking helps detect fluid retention early and is crucial for managing heart failure. 37. A nurse is planning care for a client with severe heart failure. Which intervention best promotes skin integrity? 1. Apply emollients daily. 2. Reposition every 2 hours. 3. Keep bed linens dry. Answer: reposition every 2 hours. Rationale: repositioning prevents pressure injury in clients with decreased mobility and perfusion, which is essential in heart failure. 38. A client with heart failure is placed on fluid restriction. Which nursing intervention is most effective in promoting adherence? 1. Provide frequent snacks. 2. Allow the client to choose preferred fluids within the limit. 3. Restrict all beverages completely. Answer: allow the client to choose preferred fluids within the limit. Rationale. Providing choice within restriction supports autonomy and improves compliance with a fluid restriction. 39. A nurse is evaluating a heart failure client's understanding of lifestyle changes. Which response indicates effective learning? 1. I'll take naps after every meal. 2. I'll check my blood pressure once a month. 3. I'll reduce salt and monitor my weight daily. Answer. I'll reduce salt and monitor my weight daily. Rationale. Daily weight monitoring and low sodium intake are essential lifestyle modifications for managing heart failure. 40. A nurse is assessing a client with heart failure who is on digoxin therapy. Which symptom is most concerning? 1. Nausea and blurred vision. 2. Heart rate of 70 BPM. 3. Mild fatigue during activity. Answer. Nausea and blurred vision. Rationale. These are signs of digoxin toxicity and require prompt assessment and possible medication adjustment. 41. A nurse is monitoring a client with left-sided heart failure. Which assessment finding requires immediate action? 1. Bibasilar crackles. 2. Cough with frothy sputum. 3. Fatigue with ambulation. Answer. Cough with frothy sputum. Rationale. Frothy sputum suggests pulmonary edema, a life-threatening complication of left-sided heart failure requiring urgent intervention. 42. A client with heart failure is started on enalapril. Which finding should the nurse report to the provider? 1. Blood pressure of 118/72 mmHg. 2. Persistent dry cough. 3. Heart rate of 78 BPM. Answer. Persistent dry cough. Rationale. A dry cough is a common side effect of ACE inhibitors like enalapril and may require switching to another medication class. 43. A nurse is reviewing lab results for a heart failure client receiving furosemide. Which value is most concerning? 1. Potassium 3.1 milliequivalent/L. 2. Sodium 138 milliequivalent/L. 3. Creatinine 1 milligrams per deciliter. Answer. Potassium 3.1 milliequivalent/L. Rationale. Hypokalemia is a common adverse effect of furosemide and can lead to arrhythmias in heart failure patients. 44. A nurse is prioritizing care for 4 heart failure clients. Which client should be seen first? 1. Client with pitting edema and mild dyspnea. 2. Client with oxygen saturation of 88% on room air. 3. Client requesting pain medication for headache. Answer. Client with oxygen saturation of 88% on room air. Rationale. Low oxygen saturation indicates impaired gas exchange and is a priority concern in heart failure management. 45. Which intervention is most effective in reducing preload in a client with acute heart failure? 1. Elevating the legs. 2. Administering for diuretics. 3. Encouraging fluid intake. Answer. Administering for diuretics. Rationale. Diuretics reduce fluid volume and venous return to the heart, effectively lowering preload in heart failure. 46. A nurse is providing discharge instructions to a client with heart failure. Which statement indicates the need for further teaching? 1. I will take my medications even if I feel well. 2. I will weigh myself once a week. 3. I will elevate my legs when sitting. Answer. I will weigh myself once a week. Rationale. Clients with heart failure should weigh themselves daily to monitor for fluid retention and detect early signs of decompensation. 47. A client with heart failure is experiencing increased fatigue and weakness. Which laboratory value should the nurse evaluate first? 1. Hemoglobin. 2. Sodium. 3. Glucose. Answer. Hemoglobin. Rationale. Low hemoglobin can reduce oxygen carrying capacity, worsening fatigue and contributing to symptoms of heart failure. 48. A nurse is caring for a client with heart failure who becomes increasingly confused. Which initial action is appropriate? 1. Reorient the client. 2. Assess oxygen saturation. 3. Administer a sedative. Answer. Assess oxygen saturation. Rationale. Confusion may result from hypoxia and heart failure. Oxygen saturation should be assessed immediately to guide further care. 49. A nurse notes that a client with heart failure has 2+ edema in the legs and crackles in the lungs. Which collaborative intervention is most appropriate? 1. Offer fluids every hour. 2. Encourage ambulation. 3. Administer a prescribed diuretic. Answer. Administer a prescribed diuretic. Rationale. Edema and lung crackles indicate fluid overload, and diuretics are used to reduce excess fluid and improve symptoms. 50. A client with heart failure is on a fluid restriction of 1,500 milliliters per day. Which strategy can help ensure adherence? 1. Allow unlimited ice chips. 2. Measure all oral intake, including soup and gelatin. 3. Instruct the client to drink 500 milliliters with each meal. Answer. Measure all oral intake, including soup and gelatin. Rationale. Accurate fluid restriction management requires counting all sources of fluid, not just beverages, to prevent fluid overload. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.